Healthcare is on everyone's minds lately, in large part because of the coronavirus, which just won't go away. There are still so many questions about COVID-19. Dr. Robert Tiballi, an infectious disease expert with the Catholic Medical Association, joins us now with some answers. And Doctor, the 4th of July is around the corner. Beaches are reopening here in New York, so everyone wants to know the sunlight's effect on the virus. There have been reports that coronavirus appears to die quickly in direct sunlight. Your thoughts?
I think that's a reliable take that the coronavirus will not survive a nice, hot, direct sunlight, sort of sun-drenched area. I would still not take any chances about getting too close with many people. Avoid close contact with people who are breathing heavily or coughing, even if you're in the water. We want people to resume as much of a normal lifestyle as possible, but yet still be very adept at preventing themselves from having inappropriate contact with coronavirus.
All right, so if it doesn't last in direct sunlight, what about the fact that the warmer weather states like Florida, California, Texas, they're all seeing a resurgence?
Well, heat and humidity does not appear to have any effect on decreasing transmission. Direct sunlight, however, is different than heat and humidity.
Okay.
And what's happening now in Florida and in Texas and the desert Southwest is that there's a significant rise in the incidence in younger populations. So the average age of the people being infected is dropping from the 50s and 60s down to the low 40s. There's a lot of 20 to 40-year-old people becoming infected, and their infections are not nearly as severe as older folks that may have multiple comorbid conditions. A lot of the people who are suffering now in those areas where it's spreading have other risk factors like being significantly overweight, which is one of the leading risk factors for difficult outcomes with COVID.
Okay. And now I can't tell you how many times when I had a sore throat, my mother would tell me to gargle with salt water. Now a team at the University of Edinburgh is testing to see if gargling and flushing out your nose with salty water could treat COVID-19. Is that possible?
Well, the virus is enveloped in a lipid-laden membrane, and anything that disrupts that membrane can disrupt the virus. So we do know that significantly salty solutions are very helpful in doing that with other viruses. It may work well for COVID. Gargling with hydrogen peroxide is also another way that you could actually help defeat the virus. That's not really toxic. You wouldn't want to swallow the hydrogen peroxide, but gargling or brushing teeth is okay with hydrogen peroxide.
I see that mom always knows best. All right, a preliminary study out of London looking at patients hospitalized with COVID-19 found that the disease could cause brain damage. What are your thoughts on that? And could a recovered COVID patient suffer a brain-related complication later on?
Well, some of what they were talking about was strokes, which we do know the COVID can trigger a prothrombotic state and induce strokes. However, COVID is a body-wide infection for a lot of people. They get disseminated infection. They can actually have direct heart muscle involvement. They can develop hepatitis, and you can also develop something called encephalitis, which is an infection of the brain matter itself. This is probably more common than we realize, but there's a lot of people with severe cognitive dysfunction when they do develop COVID infection, and some people actually have seizures, edema of the brain, or could even die a neurologic death from COVID. However, it's not that common, but it's much more common in the elderly.
All right, wow. Dr. Robert Tiballi, thanks so much. We'll see you again soon.
Okay, thank you again.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.